My experience with COVID-19 is somewhat limited. I was one of those people on a cruise ship, and you can see in the map that we were wandering around in the South Pacific for a while trying to figure out who would take us, and then pictures of the ordeal that we went through to get off the cruise. Not one single individual on our ship got sick, so that just shows you what good hand washing will do. On a more serious note, though, I did work with the CDC on their nurse triage line project back in 2012, 2013, when they were doing a feasibility study to figure out what to do for H1N1 if it hit. And so when I got home, called AAACN and said, could we please do this? I think there's a need. So you can see here at the top of that slide, all of those tabs I have open, those are all tabs that I was researching, and this is how I've spent my time 16 hours a day for the last few days. So, a little disclaimer, because we always have to have those. There is a surprising amount of medical literature available right now, as recent as this disease is, but there's really nothing published on telephone triage with COVID except the protocol guidelines that were written by Drs. Barton Schmidt and David Thompson. We'll talk about those more later. But otherwise, I've just really had to extrapolate. And so I have studied and studied, but this slide used to say the information may change tomorrow. I changed it this morning to say it will change tomorrow. So each of you is responsible for keeping up. What I tell you today, for example, I've been telling people not to wear masks because it made them fiddle with their face and get cooties on their face. Now, of course, that's the wrong information. So just please, please keep up. And be sure that you do not follow any recommendations or suggestions that I give you today if they don't feel right to you, if they don't make sense. And I promise you some of this stuff is going to be outdated soon. So these are the 4 topics that major chunks of information we're going to try to cover. The emergence and description of what COVID-19 is, what we think we know about it now, clinical considerations, and then I'm going to try to talk about some telephone triage guidelines. So, this novel coronavirus first presented at the hospital in Wuhan, China, December 26th. And the fellow who came in had an onset about 2 weeks prior to that. He was not, he was not the first person to have symptoms. Somebody beat him by 2 days, they realized in retrospect. But this gentleman that presented to the hospital died January 20th. On December 31st, the Chinese and world authorities were alerted. There were approximately 100 cases. By January 7th, they had sequenced the illness and identified it as SARS-CoV-2. By the 13th, there was a test available. The 23rd, Wuhan City shut down. The 30th, the World Health Organization issued a global alert because there were 7,800 cases at that time. 3/11, with 118,000 cases, the WHO declared a pandemic. 2 days later, the United States declared it a national emergency. And then you can see, I've been putting the numbers up for the last 3 days just so that we can see how it is still growing by leaps and bounds on a daily basis. So what we know about the virus is it's a coronavirus. There are 7 coronaviruses. There used to be 6. Now there are 7. Most of them just cause a common cold, although I have been told some of them can be pretty nasty. But then coronavirus number 5 was SARS, which broke out in 2003, and then MERS in 2012. Now we have the SARS-CoV-2, which causes the disease COVID-19. The reason you'll see it referred to as SARS is because it's very similar genetically to the original SARS virus, but it does not act the same way clinically. So my son is an ID physician, and he has been some of my resource here. And so I was trying to understand what actually happens with these people, because y'all know inquiring minds want to know. And evidently, it's when the virus takes over the body, there is a massive immune response, which many of you will know is a cytokine storm. And a bunch of immune cells just surge into the lungs, resulting in ARDS, acute respiratory distress syndrome. There has also been evidence, and I have not done a lot of reading on that yet, but there's been evidence of myocarditis and also liver and kidney problems. And as my son put it in his medical terms, these people get sick as stink. And this is what he meant when he said sick as stink. As you can see, this is a patient in the hospital on day 8 of the illness, and then day 11, their lungs are heavily involved. Johns Hopkins has provided us with a worldwide map and case counter that you can access. As of today, there are 1,360 cases. There have been almost 76,000 deaths, probably 76,000 deaths since I downloaded this 5 hours ago. I do want to comment right now. You'll notice on the bottom of most of these slides, almost every slide is referenced, and these are live links. So I am going to, at the conclusion of this, I'm going to have my webmaster actually post the PowerPoint slides themselves to my website, so that if you would like to access those slides, you can use them. If you have colleagues you would like to present some of this information to, probably the most helpful part of having the PowerPoint itself will be having these live links. You'll just be able to click on them, and they'll take you directly to these sites. And then hopefully I will be able to make some efforts to keep these slides updated as time goes on. So there is an organization, the Institute for Health Metrics and Evaluation, that has been running predictions for what's going to happen in the United States and actually the world. And one of the predictions that they've made that really got my attention is that they do expect or predict that the end of the first wave will be here by early June. But look at this. They estimate 97,000% of the U.S. population will still be susceptible. So our efforts to suppress this disease, social distancing, and so forth, we're going to have to be very diligent for a while, because these predictions assume that we're maintaining effective social distancing. This is their graph from what they predict for the United States. They say that the U.S. is going to peak. They expect us to peak at on April 15th. You can see in the top right corner, they also have information about how many hospital beds are needed and what the bed shortage will be, ICU beds needed and ICU bed shortage. The ICU bed shortage is part of the total bed shortage. So the bed shortage numbers aren't quite as dismal as they appear, although good grief, over 20,000 beds short. That's pretty overwhelming. And then they also talk about how many ventilators we're going to have at peak, 25,000. What they don't tell us is how many we have right now. I pulled this up to show you an example of what it looks like when you look at a specific state, which you can do with the drop-down list near the top. I pulled up New York because that seems to be our epicenter. They're supposed to peak tomorrow. And then here is the information about, you can slide this, you can slide up and down the graph horizontally and see what the requirement's going to be on each specific day. So I went ahead and ran through all of the states, and actually this slide says this is accurate as of yesterday. I've gone through and checked it again this morning, and these numbers have not changed. So as we said, April 15th for the U.S. The states that they say have already peaked are Vermont, Louisiana, Washington, D.C., Colorado, and Denver. Although I talked to somebody in Colorado yesterday that said, oh, no, we haven't. Not only is New York predicted to peak tomorrow, but Michigan and Ohio as well. And then the predicted peak for the remaining states is predicted to occur between April 12th and April 29th. You can go to that site and look at your own state. Rhode Island and Wyoming will be bringing up the rear. So here's what we know, or as I pointed out on the slide, what we think we know. So we have thought for a while that older adults with comorbidities were at especially high risk, but there's actually been some impressive data published that confirms that. So it looks like our highest risk group is older adults with comorbidities. However, what we're finding out with time is that people of all ages are susceptible to severe effects of this disease, especially those with comorbidities. So you all know this: lung disease, cardiovascular disease. Next on the list should be diabetes, patients who are immunocompromised, obese, chronic liver disease, undergoing dialysis, and liver disease. Now, the things that I'm including here are the things that I thought I would want to know if I were on the phone triaging patients. So I am going to report some of the findings from the medical literature to you. And first, let me say, it's been observed that not all patients who have COVID-19 are going to have abnormal chest imaging. But look at this. There have been 3 separate studies published, one from Wuhan, China, one from the Diamond Princess, and then one from Italy. And you can read these at your leisure. But in Wuhan, 100% of their asymptomatic people that they imaged had abnormalities on CT. On the Diamond Princess, they tested everybody, took them all to the hospital in Japan, I think, imaged all of them, and half of the asymptomatic patients, 82 of the 112 were asymptomatic, which in and of itself is impressive. Half of them had abnormalities on CT. They did imaging on all of those patients. And then in Italy, this was a little bit different, but what maybe many of us will be seeing, this was a doctor's office in Italy that was closed for 2 weeks. So everybody was essentially, effectively on quarantine. And when the quarantine lifted and the office opened, 170 people rushed in there requesting chest x-rays to know whether they were okay or not. All of these 170 patients were either asymptomatic or complaining of only malaise. And I don't know why, but they mentioned that they had a temp less than 99.5. There was no laboratory testing to confirm these cases. What they found, and so she did chest x-rays on all 170 of these people, and 100 of the 170, 59% of them had abnormal chest x-rays suggestive of bilateral pneumonia. Now,